Good morning and welcome to Today in Putnam County, hosted by Putnam County Mayor Randy Porter, the show that takes a look at the events and what's happening all around Putnam County, as well as interviews with local, community, and business leaders. And now, sharing his insights and experience, here's Today in Putnam County with County Mayor Randy Porter.
Good morning. Thanks for joining us this week. Hope you're having a great weekend. Our show this week is about our Putnam County Health Department. Its recent expansion, a breakdown of all of its services they offer to our community. My guests this week are Director of the Department, Miss Lisa Bumbalough, and Miss Kristen Reeves. Good morning, ladies.
Good morning.
Good morning.
Glad to have y'all on the show. I appreciate what y'all do for our community. Lisa, you know, as I've said, I had one outlook on the health department that I remembered from a child of going and getting my vaccinations.
Right, I think that's what a lot of us remember.
Mm-hmm.
And still had that up until the tornado and COVID hit. And then I got a whole new perspective on the health department and what you guys do. And I've told you many times, y'all are my true heroes now because of what you went through and what you did. You were right by my side during the whole tornado thing, working on bad situations. 19 deaths we had in that tornado. You did an amazing job, you and your people. And then COVID hit, like a week or 10 days or something right after that?
8 days.
I'll never forget.
I didn't realize it was that soon. I knew it was close, but I didn't realize it was that soon.
So we're dealing with the tornado. It's about a week after. It's the first of the next week. And we're finally starting to, we done the search and rescue. We're into recovery. And Lisa says, I need to talk to you. And she comes, and that's the last thing on my mind. And then, boom, we had our first case of COVID. And we went from doing daily updates on the tornado to doing daily updates with COVID too. And of course, the next 2 years were terrible. But I watched your people in rain and storms and snow and sleet and hot weather do testing and vaccinations. I had a whole new perspective and a whole new appreciation for your folks. So y'all did a great job.
Thank you. We love our community, and that's the driving force of everything we do in the community, whether it's responding to a pandemic or it's treating the sick at the health department every day, or if it's just, helping people stay well. We love the community, and we're here to serve. That's part of our mission.
Well, and they love you. They've seen the general community, general public has a different perspective too, I think, since the tornado and COVID. So you had a lot of great things happening. We just had a ribbon cutting for your new expansion. Let's talk about that. We had a joint effort between the state and Putnam County where that we used ARP funds and state use funds, and we were able to build you a new addition because you found out early on in the pandemic you did not have the facility to be able to take care of those sick folks that were contagious. And this is a big part of being able to fix that for the future, but also to be able to do a lot more things with the health department, right?
Right. Being able to isolate individuals that are sick or contagious into an area that will not contaminate the rest of the building was really important. And we saw that during COVID. As you know, we see a lot of different age groups in the health department, but we see a lot of children. And being able to separate them from our primary care patients in the main part of the building is really beneficial. And we've seen a big reception of the public of that, being able to separate those folks. So we're glad, definitely happy to have that wing.
So you got a new wing that allows you to, if you have another pandemic, God forbid, or something serious like that you can separate these folks. But on a day-to-day basis, you're using it for the kids, right?
Yes, every day we use it. That's mainly our WIC clinic, but we also do a lot of child health immunizations. So it is mainly the kids wing, but like you said, we can, segregate it off if there is another pandemic. It runs on its own generator. It can be completely separate. We had also thought if we have another natural disaster like a tornado, we could set it up for like a triage area, and take in like the walking wounded. And again, it's completely separate, from the main health department. So we're so thankful for the extra space.
Yeah, and you also expanded your pharmacy and medical storage.
We did. Our formulary has grown in the last, I don't know, do you know how many more medications we have?
People probably don't realize that, do they, Lisa? The general public, that you actually have a pharmacy that you write prescriptions get
for our
filled out.
established patients. Yes,
and it is like we do have a formulary that's set, by the state, and it's mainly for like those that are uninsured, and we can also give it to patients that are insured if their insurance, doesn't cover medications, or it's like, an extremely high amount that they have to pay for their meds, but it is mainly for the uninsured, and then we can call in prescriptions for the patients that have insurance or have an outside pharmacy.
Wow.
But most people don't even realize, like you said, that we even have that available.
Yeah, health department's changed over the years, hasn't it?
It sure has. We have 6 providers now. They're great. We have so many new patients coming every day that know our providers and want to see them. And they have insurance. A lot of our patients have insurance, but they realize the quality care that we provide, and they want to establish care with us. So we, of course, love that.
We're talking to Lisa Bumbalough and Kristen Reeves with the Putnam County Health Department this morning. Just had a ribbon cutting for a new expansion that we did at the health department. Joint collaboration between the state and the county to add a new expansion, a new wing to be able to handle if we ever have any contagious diseases in the future. But on a day-to-day basis for the kids and the folks that they see, also expanded their pharmacy, their medical supply, and we added a drive-through canopy. Who would have thought? You remember when Lisa was the health director back when we built the building and then moved in back in 2009, and I was fortunate to be able to oversee the building project of it and the emergency services building over at the 911 center. And I'll never forget us standing outside that building and Lisa said, we'll never be able to fill this up. It was huge, wasn't it? Compared to what you had, compared to the old health department. Exactly. It was, and we thought, oh, wow, this is going to be for years. But nobody could predict how fast our county has grown.
Well, that's 15 years ago.
Yeah.
And we expanded in volume, but we've expanded in the services that we offer and the programs that we offer the community. There's just so much more that you can come to the health department to receive.
With the pandemic taught us a lot of lessons, too. Having something that people could drive under.
Absolutely.
That Chris kept y'all out of the weather. I mean, I'll never forget over at the fair. Well, it started, I guess, at Heidelberg's and at the old fairgrounds. I mean, we're buying you guys battery-operated vests that are heated because we've got these carport canopies that folks are lining up and driving under for you to give testing and shots, but you're out in the weather. Who would have thought that having a canopy over you to cover you from the weather was going to be a big deal?
Lifesaver.
We'd never seen that before, though, had we?
Oh, no.
We couldn't have done it without those, I don't think. I mean, that canopy will be very nice to have, if we ever have it. Or even if we're just doing the drive-through flu clinics, that we have every year.
Well, we have drive-through flu clinics every year, usually 5 or 6 at the health department. So that's going to be very helpful just to have that canopy to drive under and be able to line more individuals up. And I think we'll be able to provide more services quicker than driving through our little porch.
Yes.
one lane.
Oh, yeah, and backing folks up. And we were able to purchase the land that sits in front of the health department, and we were building a new parking lot, got it all leveled, ready to rock it and pave it, and that's going to help tremendously, I think, going down in the future to have more space. And if you have to, you can actually zigzag folks around through that parking lot and then back under your canopy to be able to take care of if you have a lot of folks show up.
Our staff have gotten really good at traffic flow and cones
where cone placement has to be.
Cone placement. So
y'all are doing a great job, and that addition was definitely needed. And appreciate the state of Tennessee partnering with us. We have a great community here where we all work together and partner to do these things. And without, if it hadn't been for them and us partnering, we probably wouldn't have been able to do all we've done.
Yeah, we're very grateful. I think when you look at the funding sources for everything on a day-to-day basis, we couldn't do what we do without those different pots of money that come in and supplement each other and allow us to offer all these services to the community. So we're certainly blessed.
Absolutely. Hey, you're listening to Today in Putnam County. I'm your host, County Mayor Randy Porter. Coming up next, more with Lisa Bumbalough and Kristen Reeves from the Putnam County Health Department. All the great expansion and new services and different things that they're doing. Stay with us. We've got to take a break.
And now, back to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.
Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. Hope you're having a great weekend. Thanks for joining us on the show this week. This week's show, it's about some of my heroes, and I'm talking about the nurses and healthcare workers at the Putnam County Health Department. Recently had a ribbon cutting for a big expansion there of a new wing and expanding their pharmacy and medical stores, a new drive-through canopy, new parking lot, because these folks, it's not about your old health department. Health department has changed. changed. We saw that with the tornado and especially with COVID and the pandemic, and the services that they offer now they're growing by leaps and bounds. And so I've got as my guest today the director at the Health Department, Miss Lisa Bumbalough, and Miss Kristen Reeves, one of her supervisors. And we're talking about, ladies, the services that y'all offer now that most folks probably don't have a clue about. We go back to our old Health Department days and we're thinking about vaccinations and those kind of things. But because of a shortage of healthcare providers, not just in our community, but across the country, more and more has been put onto the Health Department, where you're seeing thousands of folks that don't have access to a healthcare provider today. So talk about some of the primary care services that y'all are offering to the community now.
Primary care services are basically any type of service that you would expect to receive at your own doctor's office. We are actually a physician's office. We have a physician, Matt Bolton, and 5 nurse practitioners that work there and provide those services. But it's just your typical doctor's office. And basic lab services. We have, I think, 4,800 established patients.
Wow.
In our care.
And did I see that, was it last year you had over 45,000 visits to the health?
And over 170,000 services provided last year. So it's a very busy place with a lot of moving parts.
Yeah. So you're basically providing the same services as our doctors are, but because there's not enough of those primary care doctors anymore, the old days of Dr. Francis and Crabtree and Jones and all those, are gone. A lot of that load now has been put off on you, Kristen?
I do think that we probably have been seeing more patients.
Yeah, I think that primary care in the traditional public health days, it was your immunizations, your TB, vaccinations.
Yeah, it's completely evolved from that. Yes.
And now in the state of Tennessee, we do a lot of primary care services. And specifically in the Upper Cumberland region, we have a FQHC grant. So we're federally qualified health centers. So we are able to provide primary care services on a sliding fee scale, which really is a benefit to a rural community.
Yeah.
And that allows us to slide out your fees based on your family size and income. That allows us to slide out your copays if you have insurance with a copay. It also helps you to get a cheaper price cost for your medications, whether you get them in our in-house medroom or you get them at the pharmacy. So certainly really beneficial to individuals who can't afford to pay, or their deductible is so high in their insurance, or they only have hospitalization insurance.
And we also have a lot of grants that will pay for a lot of imaging. We do partner with the hospital, and they give us a discounted rate. It's paid for through the grants. And so that imaging has even expanded since I've been working in primary care the past couple of years. And it's a huge list of images that they can get. We also have cardiologists, that come, and once a month, then we'll see our patients here in Putnam County. And
that's just a blessing. Tennessee Heart, they come over and do that on their day off based on our referrals from our providers. And it's really, really fantastic that they're giving back to the community and seeing our patients like that. Referral specialty care, it's really expensive.
Oh, absolutely.
If you are referred to a specialist, sometimes they want $200, $300 up front.
Yeah.
And, many people, you can't afford that.
Can't afford that. Shout out to Tennessee
speaking of
Heart.
referrals, I'm sorry, I didn't mean to interrupt you, but speaking of referrals, we work closely with the CRMC Foundation at the hospital.
Yeah.
There are guidelines and things, but we assess the patient's needs, and a lot of times we can fill out an application for the patient and send it to the foundation, and a lot of times they can help pay for that initial office visit cost for the referrals. So that's been a huge help to our patients. So we're so thankful for that relationship with the foundation at the hospital as well.
Absolutely.
So we just have lots of different avenues that we try to go down to help our patients and get them what they need.
It's all about working together, isn't it?
For sure.
Yeah,
we really do work in the best county. I tell everybody that.
We preach it all the time to the great community we live in, where we all work together, and that's just another shining example when you've got that relationship with the hospital and Tennessee Heart. Do you see that kind of stuff in other counties? Where they have these same things going on?
Well, unfortunately, in rural counties, sometimes they don't have.
They don't have it, do they?
They don't have even a primary care doctor.
Yeah.
So that's really sad that these rural counties do have those shortages. And then in our county, as large as we are, we also have an access issue.
Right.
With a ratio for
even as big as we are. are.
Yes.
Yeah. Hey, we're talking with Kristen Reeves and Lisa Bumbalough with Putnam County Health Department. Big expansion that we just did a ribbon cutting on there, and they've expanded their services and getting you information out that most people probably don't know about, the services that are offered at the health department. You're offering dental services now.
Yes, we're so excited. Now, we have had a dental clinic for years in the health department, but we primarily targeted children.
Yeah.
And we had a dentist 3 days a week. And Dr. Whitworth, he retired probably 7 or 8 years ago.
Yeah, it's been a while.
And we've been recruiting for a dentist, and it's been hard, but we are so excited. We have secured a dentist. She will be starting at the end of August, and she'll be working 5 days a week. She comes to us from Florida, but she has roots and family here in the Upper Cumberland.
Wow.
So Dr. Lauren Manier, and we're really excited to have her join us.
That is great. So on a day-to-day basis, folks that want to come to the health department, I mean, do you take anybody? I mean, you file insurance, you do all that. So do they make appointments like you do at a doctor's office?
You can come in, make an appointment in person. You can call us, make an appointment. We don't have the ability to have a patient portal or online process yet. We hope to have that in the future, but I think it's in the process. But right now, just call us or come by.
You also do a lot with kids, WIC, child health services, immunizations. Probably when we were all growing up, we got our shots and you didn't question it. You didn't have a choice. You went and got your shot. And I know with COVID created this hesitancy with some folks that all of a sudden they were scared of vaccines. Or is that still an issue with kids getting their vaccines now, or is that kind of went away, or where you at?
We still have some questions with families that have some concerns about the vaccines, and we try to educate them, talk them through their questions and their concerns, and show them any evidence-based studies that we have access to. But certainly we have seen a little bit of a decline, but that could be as well. They're going to other places to receive their vaccines. Not seen any statewide data over the last year, well, post-COVID, to see what the immunization rates are among children. That data does come out, but it's usually a year or two behind. So it'll be interesting to see when the Department of Health does collect all that, where we stand.
Yeah. You still do your flu shot vaccine clinics? Do you go to schools to do those still?
Still go to the schools. That's the big thing we do.
Oh, yeah. We're really excited
amazing.
to be able to go into the schools and just allow the parents to free them up that burden of not having to take their child out of school to get their flu shot. It's ease, and it accommodates them. And we have a lot of good response and comments from the families and parents about that. Of course, we don't just do it without a signature form.
Right.
Parents have to complete
They have to approve it.
form
Right.
and approve it and send it back in. And we try to hit all 20 schools in one day. So our whole staff go out.
You're kidding.
We have
We've done it different about every year, but last year we did hit all the schools in one day.
So.
But it went well. I mean,
Wow.
Yeah.
Well, and you've been great to do it for our county employees, too, and a lot of them take advantage of it, and otherwise they probably wouldn't get their flu vaccine, which helps the county because most of the time it doesn't keep you from getting the flu, but usually if you do get it, you got a milder case,
For sure.
and that keeps them at work,
Exactly.
and it's a benefit to, to the county.
And if you make it easy, we're busy. Everyone is going in, 10 different directions, so to have it available for them during the workday, just like being at school for the students, it really does help encourage us to do it, I think, and make that choice to get the vaccine.
Hey, you're listening today in Putnam County. I'm your host, County Mayor Randy Porter, talking with Lisa Bumbalough and Kristen Reeves with the Putnam County Health Department. A lot of the great things that's happening there, but we got to take a break. Stay with us.
And now back to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.
Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. We're having a great weekend. Thanks for listening to the show today. This week's show is all about the Putnam County Health Department. And as I've said many times, some of my heroes after watching them work during the tornado that hit us back in 2020 and then COVID and the pandemic, unbelievable what these ladies and gentlemen went through at the Health Department to provide services to us here in Putnam County. And we will always forever be grateful to them. A lot of good things happening at the health department. Just added a new expansion there of a new wing, new drive-through canopy, new parking lot, new pharmacy and storage expansion, all kinds of great things because they are growing by leaps and bounds. Lisa, we were talking about health care not just here in Putnam County, but across the country, there's a shortage of healthcare providers, primary healthcare providers for folks to go and see. Are you still seeing a shortage, though, of healthcare workers to be able to hire at the health department?
Yes, we struggle with an applicant pool with medical providers, administrative staff. It's just we'll post Indeed and you share those posts for us. And I don't know if it's salaries or one. I know salary is an issue, getting a competitive salary for folks that want to come. But the benefits are outstanding.
Oh, absolutely.
Working, for us, we're state and county government employees.
Yeah.
It's benefits through state and county government. So we have fantastic benefits. But yes, we do. We're struggling too. So I think across the state, probably across the country, it's just trying to find individuals who are wanting to work full time.
Do you think does it have anything to do with our younger generations? It seems like they are not interested in getting to the healthcare field like we were when we started. Do you see that?
I feel like COVID changed. We have seen more struggles and some more barriers in filling positions since COVID. I don't know if that's it. Sometimes we want to blame everything on the pandemic, but but certainly I feel that way.
Well, Kristen, what made you want to get into healthcare?
Well, I just like interacting with people and taking care of people and feeling like I'm making an impact.
That's what all of us, right? We felt like we wanted to help people. We knew we weren't going to make big money in it, but it was all about making an impact, helping people, interacting with people. But I'm not sure that attitude is there with the younger generations. COVID really messed things up, and y'all know that with people's mentality about healthcare and saying, "Oh, wait a minute, I'm not going to do that. If I've got to do all that, I don't want to do that." But
I think society sometimes teaches us and encourages us to be, it's all about me.
Yes.
Mentality. And, you really have to look at, it's not about me. No. It's about what you can give back to others, what you can do for someone else.
That's right.
That's what's going to get us further in life.
We've got to get that attitude into our younger generations that we had, that was instilled in us when we were growing up. Hey, y'all got a lot of other programs going on at the health department. Most folks may not know that you do all the birth and death certificates.
We do.
A lot of those.
Yes. I think there's probably 4,500 a year that we produce, and birth and death total. Yeah, it's amazing.
That's a big job. And then you've got some other things that you do. And one of them that you had mentioned to me, that's kind of an epidemic that's going on out there, and that's our young people vaping.
Right. We are in the schools a lot working with the staff in the school system and other partners, agencies in the community, just trying to educate the kids that, that's still tobacco. That is still harmful to your body. And you'd be surprised at the number of students that say they think vaping is okay, that they've stopped the cigarettes or stopped tobacco, but we vape, so that's okay. But we try to educate them to let them know that is still harmful to your body.
Still drawing it into your lungs, aren't you?
And when you look at the leading causes of death in Tennessee, all of them are directly related to tobacco use in some manner. That's certainly something that we try to put the word out and do a lot of education, tobacco cessation events, and encouraging individuals to stop using any type of or form of tobacco. Of course, the hospital still has that class for individuals, and we offer some classes as well, partner with a lot of different organizations that's our goal, is to just try to keep folks from using tobacco ever starting and then stop if they have been using.
Yeah, it's you see a lot of folks that have stopped smoking, but then they go to the vaping and think that it's okay, and anything you're pulling down, inhaling into your lungs besides oxygen and air can't be good. You do a lot with diabetes too, and I think it's becoming an epidemic in our country, is obesity. And with obesity leads to all these other diseases, diabetes, heart disease, and I was reading on your website about heart disease being the leading cause of death right now, and a lot of that goes back to the obesity. So you're actually doing cooking classes now? Kristen, Are you teaching people how to cook?
Not me, because I'm not a very good cook, but we have, because we do have a registered dietitian and two nutritionists that work there and do the WIC, but our registered dietitian also has started the cooking classes, and she is a wonderful cook, very educated and very intelligent, and our people that come just love it.
She'll target if you want to lower your cholesterol. She'll give you a menu and help you tailor that to lower your cholesterol, whatever need that you have. If you're looking to, you're wanting to keep a check on your diabetes, she'll help you with looking. If you want to lose weight,
yeah, I would say if you want to lose weight or
cut
anything,
carbs,
yes.
She'll give you a meal plan for that. But those classes we offer are free. There's no charge. They're open to the public, and any class that we can tailor to meet the needs of anyone in the community that will offer it. We've got a very well educated and diverse class for any ages, and the staff are just fantastic, and they love to educate.
And we also have health educators that go out into the community as well that, do target like obesity and tobacco, and, we do a lot of worksite wellness and stuff like that. So we're trying to hit all these big things from all angles, really.
Well, empower families. We want to empower parents to teach their children how to live healthier lives, to be happier, to be healthier, to be active. Sometimes it's just a little encouragement that you need is someone to just help you kickstart your journey. And that's where it comes back to, if we all could just encourage one person every day in whatever journey they're taking, whether it's, cutting back on their tobacco use, whether it's exercising more, losing weight. But if we all would do that, I think we'd see a much happier population.
We got to get our kids off the couches and video games and outside. I mean,
well, we have a beautiful community.
We do.
Have all these parks and playgrounds
waterfalls
and trails
and everything. Yeah, and it's we used to play outside for all the internet and video games and stuff. It's definitely, we changed our lifestyles, and it's hurting our health for sure. I mean, all you got to do is just go out in town and look around, and we're eating fast food. We're not exercising. We're doing all the things that we shouldn't be doing. And
well, you remember last fall we had a walking group, community walking group at the park, and we promoted it very well, and we just didn't have much participation at all. And it's free. It's a beautiful park to get outside, and I think sometimes it just takes a little bit of motivation from someone to help. So I think maybe we all need to look at just bringing someone with us and taking them on a walk and going to the park. And
nothing like that exercising. If you ever started, it's addictive. Yeah, to a good feeling that you've got, and it's very healthy. We got a minute or so left. When you start thinking about the health department and health services going forward, is there one thing or a couple of things that stick out at you that you think are going to be big hurdles for y'all going forward?
I think workforce definitely will be a problem just because of salaries. I think that's difficult to meet the demand of the public sector with the private sector on salaries. But so I do think that's a problem. And I do access. I go back to the access issue of, primary care providers and the students and the youth that are looking into going into the medical field. There's just not as many as there were years ago, from what I understand. And I think that we don't have medical providers, and we're growing in a community, then that's certainly going to have huge access issues on the communities.
Add that to the list of things that keeps us up at night.
Yeah, exactly.
Absolutely. Thanks, ladies, for being on the show. As I said, I appreciate y'all. Y'all are my heroes, and what y'all do for the community, it definitely doesn't go unnoticed. I hear people talk about it all the time, so I appreciate what y'all do.
Thank you.
That's our show for this week. Hope you join us every weekend for Today in Putnam County. I'm County Mayor Randy Porter. Hope you have a great rest of your weekend, and may God continue to bless Putnam County.
You've been listening to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.